I'd like to begin by expressing my gratitude to the Public Petitions Committee and everyone who contributed to the inquiry and the report. It's been an excellent debate and I welcome the contributions from colleagues right across the chamber. Listening to the convener, Joanne Lamont, in her opening remarks, it was heartening to hear that the committee found evidence of good mental health services across the country and strong examples of partnership working. That's really important. And I think it's also really positive that we are, as a country, speaking much more openly about mental health. That has to be welcome too. However, it's clear from the evidence that there are gaps in support that must be filled. And urgent action is needed to ensure that every child and every young person in Scotland receives the right support when they need it, and support for their parents and carers too. That came across really strongly in the comments from Joanne Lamont and others. Annette Mackenzie has shown great courage in the face of the worst adversity possible. The tragic death of her daughter, Brittany, has clearly made a mark on the committee members and those who have supported Annette and her family. And I think it was right to hear the convener recognise that Annette's petition has been the catalyst for this comprehensive committee inquiry. Presiding Officer, the mental health of young people in Scotland has been a prominent issue in Parliament during my time here. Before COVID, we know that youth campaigners in Scotland described the growing mental health crisis as their generation's epidemic. Long waiting times for mental health treatment are intolerable and urgent action is required to prevent our children and young people falling deeper into mental health crises. And life in lockdown, as we've heard today, is affecting the mental health of people of all ages and from all backgrounds. But for children and young people who maybe don't understand the magnitude of what's been happening, and those who have experienced direct trauma, it is very, very difficult. And the Minister for Mental Health has acknowledged today and before that the Scottish Government does anticipate an increase in demand for mental health services. And we've heard from colleagues today, including Beatrice Wishart, the important role that our schools are playing in supporting young people in these difficult times. Now, more than ever, adequate funding for not just the NHS, but also for our vital third sector organisations who provide lifeline supports are required. We've heard about the importance of proper pathways and, importantly, signposting, because I think we all know about examples in our community of really excellent services, but how many of our constituents know how to access them at the point of crisis, or more importantly, before the point of crisis. And just as the impact of COVID-19 hasn't just affected businesses, it has hit the voluntary sector hard. Many charities haven't been able to fundraise. But if I just take a moment to join the Minister in paying tribute to the mental health workforce who have had to adapt enormously during the pandemic, and I welcome her commitment to addressing unacceptably long waits for CAMHS, as even figures today have highlighted. To also show an area where I think we are beginning to make some progress, I want to thank the Minister for her work recently in bringing opposition spokespeople together with experts from charities and also, most importantly, young people with lived experience. And that's on the issue of self-harm, which I don't think this Parliament has addressed enough in recent years, but there is a commitment cross-party to do better. I was shocked to learn that 1 in 6 young people between the ages of 16 and 24 in Scotland have self-harmed at some point in their lives. And we know that prevalence of self-harm also increases with deprivation. People living in the most deprived areas are more than twice as likely to self-harm than people in wealthier areas. And I think these factors are true of mental health generally. Self-harm is mentioned in almost 1 in 4 contacts from under 18-year-olds to the Samaritans helpline service. So I'm grateful to the Minister for bringing people together on this issue. It's clear that in this Parliament there is a lot of passion to get this right for all young people. In terms of some direct commitments, SAMH are asking for each local authority to have a central mental health hub that children and young people are referred to if they need support that is not readily available to them in the community, where they can be quickly assessed by a multidisciplinary team and connected to the support they need without the threat of rejection. I think that's really important. They're also asking for the professionalisation of personal and social education, with mental health education a core part of PSC. And again, I think that's just one example where it shows that it's not just down to one minister to get this right. We need all parts of government working together. To pick up on a local example, Presiding Officer, and the Minister will be familiar with the work of FAMS, Families Affected by Murder and Suicide, Lanarkshire-based charity founded around 7 years ago to support families affected by murder or suicide. They've recently been in touch to say that they are financially vulnerable due to not being able to fundraise, but demand for their services is overwhelming. And they say the cost of FAMS closing to the NHS and emergency services could be thousands of pounds in terms of visits to A&E, GPs and so on, but the cost in human terms would be immeasurable. So we need to act because we can't leave a generation of children and young people behind. I was very struck by words by Annette Mackenzie, whose daughter Brittany has inspired much of today's debate. Annette said that Brittany's beautiful smile hid a world of pain. Her smile could brighten up the darkest of days, just not her own. And as we think about building back better after COVID, we need to build back kinder. So I'll finish with Annette's words, Presiding Officer. She said, reach out to all your friends tonight. Let them know you love them and are glad for them in your life, and you are here for them. Thank you.